children's health insurance, the S-chip debate, got a fair amount of play in the news over the past year. Certainly, like this is another place where the incumbent, Mr. Coble, has sketched out a position where he said, on the one hand, he wanted to fund children's health insurance. On the other, he had concerns about expanding to, nationalized healthcare, single-payer system. He also expressed some concerns about using tobacco taxes to fund the program. The question's really two-part. One, how do you view that S-chip bill that was proposed and vetoed by the president? Would you have voted for it as it was, with primarily funded with tobacco taxes and expanding it as it did? And then could you talk a little bit about what else Congress ought to be doing in the healthcare arena over the next 2 years?
Yes, this is an issue that really strikes home. And I've read all the information all the information I can get. And in reality, what we need to do is scrap every health system we've got and put everybody under national health care. Is it because we want it? No. It's because we need it. Every industrialized nation, every civilized nation has national health care. Do we have to pattern ourselves after the Canadians or the French or the Germans? No, we do not. We can do our own thing. We're Americans. We can do something even better. And they'll tell you over and over again, and tell you can't afford it. Well, let me tell you what you can afford. You take the premiums you're paying now, you take the contribution from your employer, you take the greed and the gouging out of the system, and you've got enough money to pay for national health care, and you'll actually get better care. They don't want to admit it because there's so much money going into Congress to pay for their vote that you don't have a chance. When I'm there, you're going to have a chance. And even though we get a president that will be for health care, she's got to have the right support in the House and the Senate to get that health care through, or we'll get something less than what we need. And it's real simple. This is what you gauge it. Do I have the same health care that Howard Coble's got? And if you do, then you've got national health care. If you don't, you've got something compromised. That wouldn't be fair to you because you're paying for his. You're already paying for yours. You're being denied what you're paying for.
Okay.
I would have voted for S-chip, and I would have voted for it with the tobacco tax. Because the ability to give 10 million children health care far outweighs the $1 a pack tobacco tax. I currently am a smoker. I will admit that up front. It's been in the papers, people know it. And I would pay $1 more a pack. I'm sure, Johnny, you would pay $1 more a pack as well. It is the great moral issue of our time, it really is. I want to see national health care, universal health care. I want to see a single-payer program. I want to see the for-profit insurance companies taken out of this business. There is no need for a for-profit insurance company to make your health care decisions for you or tell your doctor how to make your health care decisions. That's between you and your doctor. We are 26th on the list of industrialized nations when it comes to health care. And with all due respect to the other nations, we should be first. We are a very wealthy country. I have a plan to pay for my health care system. It includes changing the corporate tax code to stop the outsourcing of jobs and take that tax money we're bringing back into the pool and put that towards universal health care, as well as repeal the Bush tax cuts for the rich. That's $40 billion a year back into the pool, which leaves us another $50 billion to make up. If you take the funding for Medicaid and Medicare and put that into the pool as well, we're at $90 billion. That covers everybody in this country. No loopholes, nobody left out. Complete and total universal health care, something not a single national candidate is truly talking about right now.
The answer is yes. I would have voted for S-chip as it stood. It expanded the system to cover 6 million more children. It included mental health coverage, dental coverage. It still gave the states freedom to decide how they would handle things. It was an excellent bill. I'm very sad that he could not see to his way to doing that. We've recently gone on the hook for $35 billion which would have, for $30 billion to bail out Bear Stearns, and this would have almost completely covered what it would cost for the next 5 years if we'd expanded S-chip. I think that we need to expand S-chip. We need to fully fund Medicaid. I do not believe that we should, at this time, immediately go to a universal single payer. When we look at other countries, we have England, who owns their own system, owns their hospitals, employs the doctors. We have Canada, which has a system where each province is the funding agent, but they do not own their hospitals. You have the Dutch system, where they have a group of private insurance companies who offer a standard program. We have many, many different programs that exist in other developed countries. We do not have to emulate any one of them, and we will develop a system that's uniquely American. But the most simple way to rapidly cover everybody would be to expand what we have, to add a nonprofit program for people who are uninsured. We could do that within a year or two. And you say, well, I'm protecting the insurance company. If any of you are doctors, you know what most physicians feel about insurance companies. We do not look upon them with great love. However, I do respect the fact it's a major industry in this country. It employs a large number of people. It makes a profit. We've lost a number of industries in this country who have gone overseas. I do not want to destroy another one immediately. Should we establish a system that evolves to a single-payer system? I think that's great. But I think we have to look at what can be reasonably done now.